Welcome to the deep dive. Today, we're digging into something that's really shaken things up for manual therapists since about 2020, fascia.
Yeah, absolutely. It's moved way beyond that old idea of just, passive packing material.
Right, it's not just stuffing anymore.
Yeah.
We're now talking about this dynamic, interconnected system, this kind of fascial continuum throughout the entire body.
Exactly. And one of the biggest updates is realizing fascia is a major sensory organ. Seriously. It's packed with nerve endings.
More than muscle in some places.
You got it. Think about the thoracolumbar fascia in the lower back, or even fascia around the jaw muscles. Higher density of sensory nerves than the muscles underneath.
Wow, so that directly impacts proprioception, knowing where your body is, and pain signaling too.
Precisely. Nociception as well. Given its sheer surface area throughout the body, some researchers are even arguing it might be our largest sensory organ. It's constantly sending info back to the brain.
Okay, so sensory.
Yeah.
But you mentioned more. Regulation.
Yeah, that's the other huge piece. It's got autonomic nerve endings, too. This suggests fascia plays a role in, things like our stress response, maybe even how our nervous system is balanced.
So it could be a link between, say, physical tension and chronic stress states.
That's the thinking. It's like this interface, integrating information, almost reflecting our overall physiological state.
Fascinating. Okay, let's break it down a bit. When we say fascia, it's not all the same stuff, is it?
No, definitely not. We usually talk about four main types. There's the superficial fascia, right under the skin.
That's the one with more fat, sort of looser.
Right, it has fat cells, fibroblasts, mast cells, but also lots of nerves, blood vessels, lymphatics. It's really important for sensation, skin mobility, fluid exchange.
Okay, then deeper.
Then you've got the deep fascia. This is the denser, more organized stuff that wraps around muscles, forms compartments, like the IT band, for instance.
That's the one we often focus on in manual therapy, right?
Often, yes. It's rich in collagen, but also this crucial molecule, hyaluronan, which helps layers glide. And it has specialized cells called fasciocytes that produce hyaluronan. It's key for force transmission and proprioception, too.
And the other two, quickly.
Visceral fascia surrounding the organs, allowing them to move. It's got autonomic innervation. And neural fascia, which protects and supports nerves.
Got it. Let's talk more about that force transmission. How does fascia actually do that?
Well, because it's this continuous network, tension from muscle contraction or even external forces gets distributed through it. It doesn't just stay local.
So a restriction in the foot could theoretically affect the low back through these lines of tension.
That's the concept, yeah. The interconnectedness allows for that global distribution of forces. Plus, it's elastic. It stores and releases energy. Think jumping or running.
And viscoelastic, what does that mean practically?
It means it can slowly deform under sustained load, like with stretching or sustained pressure, and it doesn't snap back instantly. It adapts. Hyaluronan and water are critical here for that gliding quality.
Which brings us back to hydration.
Absolutely crucial. Dehydration can make that hyaluronan more viscous, more sticky, less glide, more potential for restriction, and maybe even pain.
Okay, so taking all this new science,
Yeah.
how does it reframe the manual therapies we're already using? Does it validate them?
I think it strongly supports many of them. Myofascial release, for example. Knowing fascia is so sensory rich gives a clearer mechanism, right? You're stimulating mechanoreceptors, influencing pain signals, proprioception.
And deep tissue. It's not just muscle soreness we're affecting.
It's definitely not. You're impacting that deep fascial layer, improving glide, potentially breaking down adhesions or densifications, especially in scar tissue, affecting how forces transmit through that whole region.
Even things like rolfing or structural integration.
Yeah, the focus on alignment and whole body patterns fits very well with this idea of the body-wide fascial network influencing posture and movement. Research shows effects on tissue stiffness and blood flow, too.
So when our hands are on the client, what are we actually doing based on this new understanding?
We're likely doing several things. Stimulating those mechanoreceptors, for sure. Probably improving the slide and glide between layers. Maybe by affecting the viscosity of the hyaluronan or local hydration.
Like with hydrolyse techniques people are talking about.
Kind of related, yeah. Influencing the fluid dynamics. And definitely having neuroregulatory effects, calming the nervous system via those autonomic connections. Modulating pain perception. Remember, dysfunctional fascia itself can be a major pain generator because of all those nerve endings.
It really sounds like we need a more integrated way of thinking about treatment.
Exactly. A fascial integration system, if you will. It means holistic assessment, look globally, not just locally. Think in layers superficial deep.
And incorporating movement.
Yes, movement-based therapy is key. Consider the neurofascial links. And again, hydration. Maybe modify techniques longer, broader strokes for glide, integrating movement cues during treatment.
So let's just digging in one spot.
Perhaps, yeah. More about restoring overall slide, assessing global movement, gentle techniques for visceral or neural fascia where appropriate. Even light touch on superficial fascia might have effects, especially for chronic pain via sensory input.
Can you give a quick example? Low back pain.
Sure. Instead of just focusing on muscles, assess and treat the thoracolumbar fascia, look at its connections up and down the chain, maybe incorporate exercises that mobilize that whole posterior line.
And tailor it based on the person.
Always. An athlete needs elasticity, an older adult might need gentle mobilization. Post-surgery requires focus on scar tissue integration. Chronic pain needs that careful neurofascial approach.
This has been a fantastic overview. It's clear the science of fascia has really leaped forward.
It really has. And understanding this allows for potentially much more effective, targeted, and truly holistic care for your clients.
The future really seems to be about integrating this knowledge, doesn't it?
Absolutely. Manual therapy and fascia research are going hand in hand. I'd really encourage listeners to keep exploring. Look up the Fascia Research Society, check out recent publications.
Great advice. Staying curious and informed about fascia isn't just academic. It's vital for improving how we help people feel and move better. Thanks for this deep dive.